in this prestigious university or IIT campus, and I found it is so vast, and the intellectual aptitude of the students as well as the staff members I found so fascinating. And I also thank the university authorities as well as the Bhaktivedanta Institute authorities, Swamijis, who have organized this program on reality, perception and thought. We have a number of lectures yesterday and today. And today morning we have first by Dr. Briggs, that is on the physical reality, and the second one by Dr. Nessin, that is on the biological reality, and the third one I am going to present on the psychological reality. So it will be a kind of three integrative processes which I am going to speak about. And what I experienced, see, we encounter a lot of things, and our perception about the reality will be changed. So I just wanted to share about a dream I had and how it changed my perception. So it was in 1990. I had a dream, and I did not know what my role there, but the dream was something like this. I was in a mortuary, and in a mortuary full of with packed dead bodies, and the dead bodies, you will see that it is charred, and if you look on the faces, there are only holes. And what was my role, I did not know. There was incense burning because in order to alleviate the stench, and also candles were there. So I was really at that time terrified about my own death. So seeing that so many dead bodies together in a mortuary. So then the next day when I got up, I was confused, and then I was a little bit worried. So I interacted with a professor of ours, psychologist. Then he simply told me that you might have seen a film, and then that might be recurring, but I have not seen any film on that. But after a few days, that is almost 1 week later, my chief editor called me and said there was a plane crash in Bangalore. That was in 91, February 14. And I was working at that time also as a journalist. So I rushed to the situation there, and then I found a lot of dead bodies being broken down from the plane and taken to the hospital, and then the others. So just going around, since as a journalist I had the opportunity to go closer. So I sent the photographs and all, and the next day, what happened? I went to visit the people who are injured and hospitalized. And then afterwards I went to the mortuary. And 1 week ago, what I saw in that dream, I really saw exactly. So I don't know how, I did not know how it happened, why it happened, and then how we could have. So again I went to my own professor, and then he told me nothing else than read the book of Carl Jung. Carl Jung's Man and His Symbols. I don't know how many of you students of psychology, how many of you have read that book, Man and His Symbols? Anyone? Can you raise your hands? Ah yes, only one. So sorry, I have seen a few of your hands. So there, in that Man and His Symbols, he has narrated his own premonitions. So what I had is a kind of a premonition. But I was wondering how we could have such a kind of premonition. Till that day, I was a hardcore physicist, and I was looking upon the psychology as not as a serious science, but as something shallow, and there are students who are doing experiments and all, it is something which I considered as cooking up. So I didn't have that much, but that day onwards, I was so serious about psychology. I wanted to learn more, and then when I did my doctorate and all, one of my interesting studies were on psychology of mind or philosophy of mind and consciousness. So that is how that dream has changed my perception about psychology. So, so this is how the perception of something that has changed my own reality and also the way I think about and I also interpret the realities. So I really congratulate the authorities in organizing such a conference, a very profound conference on relating all these reality, how you interpret, how you perceive, and then how it can be expressed in action as well as through the words. So this is my uncle, my mother's brother. He was also a Catholic priest. I myself is also a Catholic priest, and I studied quantum mechanics, physics, philosophy, theology, and everything. And he actually seen so many of mental illnesses. So therefore, he wanted to try to help them, and he developed something known as Psycho-Religio therapy. So psychology and religion together. So perhaps psychologically you might have, in the psychological classes and all, you might have encountered something known as possession cases. Have you heard? Not very much. Okay. So there are, these are all mental constructs. See, what we were seeing that, in quantum mechanics, you construct the reality. When you measure, you are constructing the reality. The same way, the mind is constructing so much of the reality. And why it is constructing? It is constructing in a way as defense mechanism. So these defense mechanisms are in a way a kind of saving the human person, and so that is the way it is creating a lot of such psychological defense mechanisms. So sometimes these defense mechanisms will be making us ill. So the mental illnesses, which you may see as multiple personality disorder, which we may need to eliminate it. Well, it is very important to eliminate it, because you will be having not a single person, but you will be different, many persons, and you encounter. So how to eliminate? So Freud would say that you go undergo psychoanalysis and all, but you may not be able to go into the unconscious. Yeah, how you can go to the unconscious, the analysis, psychoanalysis and all may not be. So this is a process through which you can enter into the unconscious and you can transform the person. And I would say that, this is not a mere theoretical one. I did a lot of such, maybe hundreds, I would not say that, thousands, but I have healed hundreds and hundreds of people, and I can say that this has really transformed and changed a lot of people, and it can do both ways. It can eliminate illnesses and you can enhance the human potential. So it is a kind of optimizing the human potential. So this is what I just wanted to share. So these are the people who was influenced. The first picture whom you will be seeing as Dr. Milton Erickson. By himself, he was a polio affected person, and he could not walk very well. And in healing himself, he was trying hypnosis, and he is the one who tried and developed into Ericksonian hypnosis. So this Ericksonian hypnosis is what we are utilizing today, and in Germany and in other places it is very popular, where you will see that, Ericksonian Gesellschaft, it is a German organization, association, where even for surgery they will be utilizing this Erickson's. So what you find it there is that, you are not commanding, you are only a facilitator. What actually is done by the patient's own consciousness. So therefore, there is nothing like resistance. Otherwise, if you are commanding to somebody's consciousness, there will be resistance. So it is the easiest way of conducting suggestions, and these suggestions will make to transform the person. And the second one is David Bohm. David Bohm is someone who has given an interpretations to quantum mechanics. That is what Niels Bohr and the other associates known as the Copenhagen interpretation. So he has given a counter interpretation to it. First it was known as the hidden variable, and in the second level it is known as the holistic interpretation. So I did not meet him, but I knew very well his associate, his wife, his family, and that way, yeah, I was closely involved in the life as well as interactions of this David Bohm's theory, and I did my doctorate comparing the Copenhagen interpretation as well as the David Bohm's interpretation. So that way, his physics interpretation is very influential. There is something known as quantum potential. Quantum potential will be guiding the particle. So that is something which is very specific about this David Bohm's interpretation. A quantum potential or a wave will guide the particle to follow. So this can be utilized in a way that, the mind can guide the person. And quite often we will see that, your thoughts will be leading. It is something like, a spark which will be igniting a vehicle, or the waves that can be driving a huge ship or something like that way. So this can be in a metaphorical way. You can say that, this quantum interpretation can be integrated into our psychological interpretations. And then the second one, the third one is Andrew Newberg, and he's a neuroscientist. I had the opportunity to interact directly with him. And the fourth one is Ernst Rossi, who was closely associated with Milton Erickson, and he himself taught me the hypnosis process. And in addition to that, a lot of other Indian, German, American and Swedish doctors and the others, they have taught me. So everything together I have integrated into a holistic account. That is what I have expanded from my own angle and his experiences to build upon as quantum psycho-religio therapy. So this is something, and you will see that I have acquired, because I didn't want anybody else to lift my painting. This is a painting which I did. Can anyone say by looking at the picture that how it was made? It is digital, and then the digital mark is also there. You could see that the Gemini. Yes, it is the Gemini. I always thought that I need to be an artist or a painter and all, it will be difficult, but you can in Gemini it is quite easy. And I would like to tell you that each one of you can try, and then definitely you will. And I was such a wonderstruck that when you are creating such a, so I didn't want to somebody to lift it, therefore I simply created it as it's a creation by my name. So now the psychological perspectives, I am going to take it out. This is from the Freud. You know, the Freud has the id, ego. So also the eros. So all those things together. So what you can see that in that symbolic presentation, that almost 1/9 will be under. So these are the unconscious. So everything, so whatever in our daily life experiences and all, you know, it will be simply sent to the underground or to the unconscious, and it will be popping up. And only 1% is what we are conscious about. So the different dimensions, you know, it is the primal engine, what is driving us. Eros is the life instinct, and also according to Freud, Thanatos, there is also a death instinct, and ego, executive mediator, and superego is the moral judge. So I am going to not to read or for what. So what is Freud? Freud is trying to explain in a psychosexual way. So he is introducing more of these sexual instincts and as a sexual drive, and it is driving the unconscious. So that is the way Freud. And the next one is Carl Jung. Carl Jung is also a fascinating personality, as I told you earlier. This animus and anima. In every man there is a woman, and in every woman there will be a man. So the animus and anima. So that is a kind of an integrated synchronicity. And also he speaks about the synchronicity and the various other. And his most important concept is that, you know, individuation. How a human person is unfolding or enfolding oneself. So the individuation process, the whole experiences which is coming to integrate into a personality. So that is what it is there. So his universality, and he is known as a psycho-spiritual analyst. He is also speaking about the wellspring of potential, self as a dynamic process, and the individuation process. I think that is the core thing we get. And he is also integrating that mythology, religion, the archetypal narrative, synchronicity. So these are some of the very important concepts which is brought out by Carl Jung. Then we can see that Adler is known for our psychologist, inferiority, superiority complex and all, you know. So our own complexes, and also the necessity of empathy, and also the necessity of social life, how we are in the social life, we are defining our own psychology. And also the goal setting. This is again something which is very important, and how he can be defined as he is psycho-social. So you can see that you know, the work, love, social life, empathy, cooperation, and objective perception, and 4 phases of Adlerian therapy is there. And important to have a relationship, explore the individual's dynamic, and encourage insight. You have to reformulate, reorient yourself, the social context and teleology. So that is what Adler is giving. And the next one is Erich Fromm. And Erich Fromm is also the existential needs and the alienation, the social filter, consensual validation, the unconscious cultural dogma. There is the existential dichotomies. Humanity faces fundamental unresolved existential dichotomies life versus death, the need for freedom, the need for security. The unconscious holds the painful, authentic awareness of these dichotomies that society encourages us to repress through mass conformity and distraction. Alienation and existential needs. The 5 key human needs must be satisfied for psychological health, the frustration of which generates unconscious anxiety, namely the relatedness, connection, transcendence, rootedness, identity, and frame of orientation. So Eric Fromm is explaining the other social dimensions. So here you can see that, the different perspectives and how we will be able to examine, analyze, and integrate into a holistic account. So you can just have a perception of what altogether rather than me reading through. So we can find that, the causality versus teleology, scope of content, the nature of repression, these are all from Freud. And we can integrate what is positive from all these dimensions. Freud superior for developmental trauma and instinctual conflict. So from the childhood onwards you have a conflict. So he is explaining about the negativities. Jung is for the superior for existential meaning and spiritual crisis. And Adler is superior for social maladjustment and education. And from superior for sociological critique and modern alienation, and from societal, that is what all this. And how to integrate these theories? The unconscious has the Freudian depths, the unconscious has Jungian heights, the unconscious has Adlerian horizons, the unconscious has Frommian walls. So this is the way you can integrate these different dimensions. We already saw that, 4 different psychological accounts on the unconscious. So how they have experienced this, it is from their life experiences. So Freud from his own life experiences, Carl Jung diversified from him, and Adler also different. So he was the first beginner, Freud, but he was concerned about more of the sexual drive, which maybe through his clinical experiences he was driven by such experiences and he was interpretation. But Jung has gone beyond it. Adler diversified into the social dimension, and from into a teleological. So we can integrate all of them in having an integral personality and also an interpretation about our own psychological growth and what Jung would say that, the individuation process. So this is what he said that, this is what Psycho-Religio therapy is a tool, and this tool can be utilized in both ways. That is eliminating illnesses, and you can enhance the human potential. So it is earlier, my uncle and the others, they were utilizing it simply for eliminating illnesses, but it could be used to elevate the human or optimize the human potential. So there are different possible ways by which you can utilize, because you are creating or you are doing a kind of a psycho-spiritual surgery to your unconscious. Normally, you will not be able to interact with your unconscious. So this therapeutic process will enable us to go deeper into the unconscious, and you can do a lot of either you can eliminate or you can delete, or you can superimpose, or you can replace. So lot of things which you will be able to do. So these are all practical. This is something like, superconductivity. So in a trance, that is in a hypnotic stage, that is known as hypnagogic state, it is between the conscious and the unconscious. So when you suggest at that time, like the superconductors, whatever you suggest, it will go into your unconscious, and the unconscious will be driving the conscious mind. So this is the process utilized in this therapeutic healing. So what I saw is that the enhancing the infinite potential of the human person, transcendence, union depth, Freudian freedom, symbolic flow, reclaimed drive, unified drive, therapeutic and existential implications. The integral psyche theory demands multi-modal approach to therapy and self-actualization, moving beyond the couch or the counseling room into active, engaged living. Why it is moving beyond the couch means, Freud used to have a couch, and then lying down on that couch, he used to conduct the healing process or analysis. That is why he is written as that. So one more thing, today morning Dr. Andrew Briggs was showing that many youngsters are committing suicides, they are also into depression. One of the reasons is that we don't have a meaning-giving mechanisms. So how to have a meaning-giving mechanism? This is another person, Viktor Frankl. So he is from Austria. So he was also a medical doctor, and he was a Jew, and he was into, many of you will be aware about him. So he was in the concentration camp, and he was married, and he had his wife, and thinking about her, talking to her, and that was the way he found a survival in the concentration camp. So that means you need to have something to hold on. As you are in a bus, when it is shaking, and you are about to fall down, and then something to hold on. So that is what the meaning. And the whole spiritual exercises and all, so what the Swamijis here and all, trying to give not only technology, but we need to have a kind of holding on. That is, the spiritual dimensions are very important, and otherwise what will happen is that, they simply lost. So Viktor Frankl is the one, therefore, so meaning through creative works and deeds, and we need to have work, love and suffering. Even in suffering, you can find meaning. So that is what Christianity or Jesus Christ is giving. Suffering is redemptive. So what Viktor Frankl would say that, how something, you need to have a cause to hold on. The transcendental dimension, ultimate meaning, humanism and self-transcendence, the existential antidote, meaning, and in the crisis of despair, we need some meaning-giving mechanism which he called as logotherapy. The therapeutic process he evolved is that of logo, or meaning or word. So I just integrated everything together into a synthesis. You have the Freudian, the Fromian, the Jungian, Adlerian, so everything together in a very symbolic way. So this is what I said, that the conscious and the unconscious. So you remember the Freudian notion that 1/9 is hidden, that is the unconscious, and only the one dimension is there. So the conscious mind is driving in that. So whatever we do, sometimes it happens that maybe your one word or a touch or some incident, all on a sudden somebody will be exploding. What is the reason? Simply resurrecting some bad experiences of the past, that even a touch or a talk or any of that triggering. That is the reason why in family or in any other social context, someone will come and explode. The reason is this one. So what is hidden in the mind simply evolves. So this hypnotic stage or hypnagogic stage is used as a way. Recently they have discovered that when you are between the conscious and the unconscious, when the conscious is encountering the unconscious, that will be a way of creativity, innovation. You might have heard about many of the scientists, in dream, Schrodinger's wave function. He has simply in dream he got, or Kekule, he found his benzene ring in a dream. So like that way, you yourself, that is why I say that, that perception of that dream, what I have, but I had. So something like that, each and every one of you will be, you may not be remembering, but these are the things which enables us, and this hypnosis is a way of putting you into this stage between the conscious and the unconscious to interact. So what is this state of hypnagogic state? It is an awareness. It is an architecture of awareness. It is a metacognition. It is a meta-awareness. So that will be leading to much of the transformation of the person. So everything together, whatever I said, the hypnosis, neuroscience and quantum mechanics. So Rosie is the person who have integrated everything into this kind of synthesis. So he has taught me, and he has given me a lot of books, and I have continued that process, and I am interacting with him till now. So that way, from the great master, I have learned this technique and expanded further. So you will see that quantum cat, the Schrodinger's cat and all those things, This is why I said that, you give a command and you describe, and you see that, So have you ever found these kinds of the background painting anywhere? Anyone? Can you say that? Yes, exactly. I simply gave the command that, Van Gogh. And I was so much influenced by Van Gogh and his suffering and all, the style which he encountered. And then all of a sudden, this artificial intelligence simply recovered and went somewhere and collected and pasted everything there. So much better than my own painting and all, So that is why I said that, it is fantastic. And here you will find this is the quantum jump, or quantum leap or whatever. So all of you who have studied physics, at least to some degree, or you might have heard that, So this is the human potential. We will be in an ordinary state, and we can go into the higher levels of creativity and innovation. So it is possible. And how it is possible that the encountering the conscious and the unconscious, we can definitely make. And the sky is the limit. You might have heard many of these psychologists will be giving the lectures or the books, sky is the limit. And it is not simply an idea, but it is realizable. And what I have heard from people from Manipur, the mountains, and or the northeast, if you want to, what is the goal of life? If you want to climb the mountains, look forward to the stars. So your goal is so high, then you will be reaching to the mountains. So that way, you realize, or you, I don't say that a dream, but it will make you to transform yourself into that heights. So it is possible. I am not simply saying that, it is impossible. It is really possible. Only thing is that you need to go beyond your own drawbacks and jump into the unknown. So perhaps we are aware about the the reptilian, mammalian, and the animal, the human, the brain. So you can see that the neocortex, the limbic system, and the reptilian. So all these different dimensions we had, but that has been simply now eliminated, and into a holistic account is now brought, and that is what we need to hold on to, what we are. So this is again another painting that is optimizing yourself, the possibilities. So what I connected together is when the physical, the psychical, and the pneumatic, that is the spiritual. So all integrated together, then you will get the wholeness. When you have the wholeness, you will have the wellness. When you have both wholeness and the wellness, then you will have happiness. And when these three are together, you will also be spiritually bound. The triune brain explanation will be saying that you are in a homeostasis, but now that also we are renouncing, and then allostasis, that is stability through change. Definitely there are changes, there will be turbulence, chaos coming in our life, but to keep yourself stable, and that is allostasis. That is the very important thing, and that is what, instead of homeostasis, this is what we are going on to hold on. So from illness to wellness, you could see that therapeutic innovation and societal wellness. Not only the individual, but the social dimension is also incorporated, so that we will be able to not only individually but collectively. So we have heard all these days about entanglement. So this is what I just shown, the physical, the psychical, and the pneumatic together. So this quantum psycho-religio therapy is an integrated therapeutic system. Why I say is that we go to the hospital, but may not be always be totally healed. So from the Bible, I think the St. Luke's Gospel, there is a passage where a paralyzed person is brought by opening up the roof, and the patient was brought down, and Jesus simply told him that your sins are forgiven. And then those who are surrounding, they were criticizing him. Why? Who is he to absolve sins? So they were all criticizing. He is not God. He is a human. Then how can? So then Jesus said, in order to understand that I have the power to absolve, he simply asked him, you take up your coat and go home. And he simply stood up and go home. So sometimes our problem will be in the soul. Sometimes it will be in the psyche. Sometimes it will be in the body. So quite often what will happen is that we only care for the physical body. So the necessity of integrating the soul or the pneuma, the psyche. So from anywhere the problem, then you will be sick. So therefore you need to heal all these three together, then only the integral healing will come. So this is again a kind of integrating all those things. And how you will be doing this quantum psycho-religio therapy, the methodology is that Suppose that you have a person with a problem, and how will you be able to solve the problem? Through analysis, you find the cause, and you also the person who is healing, need to find a solution, and you have to place that person in through an induction into hypnosis, and through suggestion, you give it to the person, and it will go into the unconscious, and that person will be healed and then brought back, and definitely there will be a change. I absolutely say that, I have seen how people are healed. It is not simply a theory, but in my own experience, and also in many others, I have seen it, and I do have a lot of experiences to share, but I think the time is almost coming, so therefore. So this is what today morning Dr. Andrew, as well as many others, and yesterday I had the good opportunity that listening to some of the presentations of the psychology students or the researchers. There I found that it is fascinating that they think about and then how maybe creating a DL or ML, but at least we need to go towards the healing process. It is very essential. That is why I put this Deepika, who spoke about her own depression, and we many have, and then I would suggest that we have a taboo. We will not be going, and then we in the marriage market, it will be, if somebody has gone for counseling, or then it will be gone down. So therefore, and then you go on, and then even when there is a problem, you will not. But what she is highlighting is that we need to remove that taboo. So thank you. This is what.
I think you got my question.
Yes. So you made a statement, I think, isn't that your own friend?
I want your comment, like for a person, those who take suicide or anything, they have something to to catch, right? To not to take that extreme step, but still they do.
Yes.
So what's your comment on this?
I remember when I was studying in Belgium, there was a person, my friend's brother. One day he came to me and told, because he has an exam next day, and I want to commit suicide. He came and told me. So what I did is that myself and another friend of mine, so we took him, and we just went for a walk, and we had some talks, and then also some tea, coffee, or so then he said, I am fine. See, there are moments when somebody will be in extreme need, and that time they will be absolutely lost. So those times you should be sensitive to understand. They give some signals. They will not be simply saying that I am going to commit suicide, as he said to me. You can find their face, actions, depressed and all, So that is the time, friends or whoever be, to intervene. So that is what I would suggest, that you need to intervene directly, otherwise it will be simply problematic.
So with time we have so many things, so many suicides happening. Can we infer that the society has become insensitive to understand their signals in that sense?
See, I would say that we can't generalize it. So you are generalizing it.